Hello, everybody. Uh, just like every Thursday, we try to have some healthy talk, little talk. Now, I'm going to talk a little bit about how to tell if your child shows symptom of depression. So basically, it is very important to know that whether your child is depressed or child has any symptoms of um, really depression. So nowadays, there are so many ways child can become depressed. So if you think your child is depressed, it's important to look it carefully, the child's symptoms. Depression symptom can sometimes appear differently in childs and opposed to adults. So it can sometimes be tough to spot these signs. So knowing what to look for in your child and depression, it's very important so that you can seek help. So I'm just today going to a bit of clarifying symptoms to what you have to look for. So depressions in the child when they are depressed tend to be different than of their, I told already, it is from adult, where low mood or loss of pleasures are often the two primary symptoms in adult with depression. Kids more likely just show the sign of irritability and physical complaints. Other symptoms of depression, if difficulty in focusing, making decision, extreme shyness, clinging to a parent, feeling hopeless, unexplained physical complaints, sleeping problem, appetite change, and thoughts of actions of self-harm. So just you have to keep an eye on that. Some of the things like sadness, a child may become sad about many things like lost relationship, schoolwork, failure, missing out of something, moving, or loss of a friend, pet, or loved one. Try to identify what your child is sad about and provide the support. If symptoms of sadness improve or disappear after just a few days, they are probably not related to the depression. Depressed child may have a general sense of sadness about their life and their future. They may not be able to identify what they are sad about. They may cry a lot, tear up frequently, or for no obvious reason. Feeling of sadness that last longer for 2 weeks are a reason to talk with your child's pediatricians or GPs. Withdrawal from family and friend. Most of the child will change friends at some point of time and spend varying time with their parent. During puberty, actually, they like to move with the peers. This is important developmental step and should not be confused with social withdrawal. Social withdrawal associated with depression. It can contribute to child's negative social experience and can reinforce depressive symptoms such as worthlessness or feeling like no one likes or understands them. Childs who are depressed may dramatically pull away from friends, family, and other who are very close to, and they tend to keep themselves and avoid interactions altogether. They might stop participation in the class, social or extracurricular activities. Losing interest in activities, also interest in what they used to love, like favorite toys and TV shows, suddenly declare they are no longer want to engage in favorite activities. This is a different form, and they are hard time finding joy and excitement in anything. And maybe indifferent and almost everything, and depressed often likes to like they are just going through the motions without any joy or pleasure of what they are doing. And also they feel misunderstood, like every child will feel misunderstood at some point of time. A depressed child may feel there's no one can understood their feeling, or it is pointless, or even try to talk with them. Your child may fear trying new things, speaking out, and started ideas out of fear or rejection, misinterpretation, and ridicule. And of course, there can be academic decline. So a depressed child may significant decline in grade, missing school, trouble paying attention, simply failing to do work, or all reasons for such decline in grades. And they may be some more apparent in child who had a high academic achiever in the past. And then also you can see the lack of energy. Everyone get sometime tired, but depression may seem always lack of energy and motivation. Then there is feeling of guilt, like excessive and unrelenting guilt are common in children with depression disorder. So childhood depression may blame themselves for anything goes wrong, even it is without their control. Guilt can be contribute to feeling of sadness, worthlessness, and hopelessness. If your child guilt seems to be worsening and more than 2 weeks it lasts, and is present with signs of depression, then we have to talk with mental health professionals. And of course, worthlessness, depression disorder feels worthless frequently, or for long period of time, especially following a negative event. Child who experience feelings of worthlessness typically thinks they are weak, inadequate, and flawed. Child who feel worthlessness may believe that they are inherently bad and everything, whatever they do, are wrong. So they not put effort on their schoolwork or engage in any unstable relationship, even not try to contact with others because they believe that their efforts will fail and cause additional problem. Of course, there is impulsivity, aggression comes. Some these children and adolescents with emotions may cause them to feel angry towards the people and things that they believe are the source of their pain. And they can lead to impulsion and aggressive reaction. Impulsive behavior and quick reaction event without regard with consequence. Impulsive behavior often, but do not always, lead to aggressive action. Aggressive behavior may be directed inward in the form of self-injury or at someone or something else through angry outbursts, harassment, property damage, or violence. So these are some of the symptoms I'm telling today about, looking, you have to look for your child's depressions, and you have to talk with a healthcare professional if you are worried about these symptoms. So I will tell later on about the causes and how to get help. So stay healthy, stay safe. Hopefully it will help you a little bit. Bye bye for today.